Welcome to the accompanying video for the core suspension with TRX workshop. The first group of exercises in this video are from the upright standing series. All of these exercises are for lower body and posteriorly based. They are performed facing inward towards the attachment point. My straps have been set to a mid-calf position. Next, we have our angled series facing inward. Like the previous series, these exercises are lower body focused, but incorporate upper body movements to increase the level of difficulty. Please note that stepping toward the attachment point creates an increased angle and challenge, while stepping backward decreases angle and challenge. Here we have our posterior upper body series. These exercises utilize some of the same movements in the previous group, but is upper body focused only. Again, exercises are inward facing and difficulty level can be adjusted by your starting position to the attachment point. Step forward to increase difficulty, step backwards to decrease difficulty. Upper body anterior exercises face outward. Again, the body is at an angle. These exercises can be done on the toes or with soles of feet flat on the ground. Changing difficulty level is the opposite of the previous series. Step backward to increase difficulty, step forward to decrease difficulty. Lower body anterior exercises have the same body setup. They can be done on the toes or with the soles of the feet on the floor. Make sure the arms are straight for both lunge variations. Kneeling exercises facing inward are not done on an angle. The spine is upright and neutral in its starting position. Kneeling exercises facing outward are done on an angle. All of these upper body exercises have an anterior focus. Like the standing series, move backward to increase difficulty, move forward to decrease difficulty. Prone movements facing inward all involve spinal extension. The TRX strap should be lowered so that the loops are about 6 inches from the floor. In the supine series facing outward, you can perform virtually any head float combination. However, just like when you're on the reformer, the neck will start to tense up as the abdominal muscles begin to tire. I would not make this section too long in a group class. To perform these exercises, make sure you lie flat with the arms straight. In your starting position, the arms should be floating off the ground. For supine exercises facing inward, be sure you can lie in a neutral spine with arms straight and taut straps. If needed, straps can be lengthened to perform these exercises. Prone exercises with feet in straps should position the TRX perpendicular to the floor. The loop should be about a foot off the ground. Hips should be in line with ankles once knees lift off the floor. If needed, straps can be adjusted slightly for this series. For supine exercises with feet in straps, the TRX should be perpendicular to the floor. Feet are flexed with heels resting in the soft loops. Soles of feet press against hard handles. To secure your single strap, take the loop in your right hand through the triangle in your left, then repeat. Tug firmly on the longer loop, the one that has just been pulled through, to secure. Keep in mind all single strap variations are advanced level. Rotating and single arm rows are done on an angle. Like all other pulling exercises, the difficulty level can be adjusted by your starting position to the attachment point. Step forward to increase difficulty, step back to decrease difficulty. When performing the single leg lunge series, make sure you're far enough from the attachment point that your leg has space to move back and forth. Be sure you are positioned so that the TRX is centered and not veering off to one side. This will affect the ability to balance while performing the movements. Most TRX stretches can be implemented as a warm-up, cool-down, or active rest period. They are usually performed with straps at mid-calf, but if you've adjusted your TRX straps previously, you should be able to execute the movements without readjusting. Remember, you can always place the hands in either the hard handles or the soft loops for a quick fix. Thanks for watching, and feel free to reach out with any questions.